Hello, I'm Dr. Beech. Back pain is probably the most common problem that we see. I would say all chiropractors probably see because most people associate chiropractic with back pain. And so I want to talk a little bit about chronic back pain today and how that can be created actually by sitting. Sitting is the most stressful position that we put ourselves in on a daily basis. And that may sound counterintuitive because we feel like we're comfortable when we're sitting. But biomechanically, they've measured actually the amount of stress that's put on the discs of the spine in different positions. So what they found is that when a person is lying down on their back, the amount of pressure on the L5 disc of pounds per square inch is about 25 pounds of pressure per square inch. When you turn over on your side, it triples. It goes up to 75 pounds of pressure per square inch. When we stand up, it's at around approximately 140 pounds of pressure per square inch. That makes sense because now we're standing. But when we sit, it goes up to approximately 225 pounds of pressure per square inch. So sitting, out of all those different positions, sitting puts more pressure on the discs of the spine than any other position we can get in. Now, interestingly enough, is 80% of the population, as the statistics say, 80% of the population will suffer from back pain at some point in their life. That's why there's that the back pain business is such a big deal. Chiropractors are in business to treat back pain, for sure, amongst other things. But there's so many medications that are given out for back pain. Certainly, all the non-steroidals, the Advils and Tylenol and all of that, people use for treating their short-term for their back pain because back pain is a big deal. Why is back pain such a big deal? Because if you think about it, a few generations ago, kind of as an entire species, we all sat down. Before then, we were pushing and climbing and pulling and digging and being active all day. And the actual discs of the spine don't have a very good blood supply. So they actually depend on movement to squeeze waste products out and to suck nutrition back into the system, nutrition and oxygen and that type of thing. The disc is a little bit like a sponge. It's certainly more viscous than a sponge, but in that same way, a sponge, you get compression and rarefaction, and you can move material in and out of the sponge that way. The discs work that way as well. And so when we're moving, we're just walking or pushing or pulling or doing all the things that our bodies are designed to do, we're actually exchanging waste products and nutrition in and out of the discs of the spine. And the discs are the shock absorbers. That's what's giving us the ability to resist what are called axial compressive forces, meaning as you're moving up and down and the spine is jiggling up and down that way, the discs are having to cushion that. So when the discs deteriorate, we lose that cushioning factor, and that can lead to a lot of back pain. Or in some cases, the disc actually can rupture, and then that can create all sorts of back pain. We'll talk about that in a different video. But the point is that sitting, because we all decided to sit down, because we became industrialized and we started working in offices instead of out, digging, in the fields and that type of thing, we all sat down, and that sitting position is putting more pressure on our back than any other position that we can be in. So this kind of begs the question, what can you do for it? And certainly getting up and moving around when you're at the office. Try not to stay in a sitting position for hours at a time. These standing desks are excellent. I recommend them highly. I've seen them now that even adjust where you can go from sitting to standing, which is nice, because then sometimes you can sit and then you can just raise the desk up and stand and work at it. But the main thing is try not to stay in a sitting position for hours and hours on end. We'll do another video on ergonomics and how to sit in such a way that it takes a lot of the pressure off the back. We'll do that in a different video. But today I just wanted to talk about the fact that sitting is the worst position that we can be in, is one of the major causes of chronic low back pain. So thank you very much, and I appreciate you listening.